Have you ever looked at a prescription bottle and seen those weird letters after the drug's name, like XL, ER, SR? You're definitely not alone. It turns out those letters are basically a secret code, and they're hinting at some seriously clever technology packed inside that tiny pill. It's a sign that your medicine isn't just a simple chemical, it's actually a tiny machine. So let's dive in and unpack the science behind how these little engines really work.
So yeah, what is the deal with those letters? Whether it's ER for extended release, SR for sustained release, or one of the many others, they all point to the exact same brilliant idea: controlling precisely how and when a drug gets to work inside your body. The whole field is known as modified release, and honestly, it has completely changed the game for how we take medicine.
But to really get why this technology is such a big deal, we first have to understand the problem it was invented to solve, and it's a problem I like to call the pill roller coaster.
Okay, so most standard pills, the ones we're all used to, are what's called immediate release, or IR. It's simple. You swallow it, and boom, the active ingredient gets released pretty much all at once. Now, that's great for a quick effect, but this simple approach creates a really predictable and often pretty problematic pattern in your body.
And this graph, man, it shows the problem perfectly. Curve A, that's our roller coaster. With a standard pill, you get this sharp peak as the drug level spikes way up, and then, just as quickly, it's followed by this deep valley as it wears off. Taking another pill just starts that wild ride all over again. But curve B, that's the goal. That's the smooth ride, where the drug level stays nice and steady, right in that effective zone for a really long time.
And this roller coaster isn't just a line on a chart. It has real-world consequences. It means you have to remember to take pills multiple times a day. That sharp peak, that can bring on more intense side effects. And the valley, well, that's when your symptoms can come right back. And what happens if you forget a dose? The whole system gets thrown out of whack. The bottom line is, for a lot of conditions, this just isn't the best way to do things. And this is where some really brilliant pharmaceutical engineering comes into play. Scientists basically asked, okay, what if we could get people off the roller coaster entirely and put them on that smooth, steady path instead? And the answer they came up with was modified release technology. So a modified release drug is one where scientists have intentionally, deliberately engineered the pill itself to control its own release. We're not talking about a simple powder pressed into a tablet anymore. No way. This is a sophisticated little delivery system designed from the ground up to hit a specific goal, like giving you that stable, convenient, all-day effect. Now this tech generally comes in two main flavors. On one side, you've got extended release. This one is all about slowing things down for that long, sustained, smooth ride effect, which means you can take a pill way less often. Then, on the other side, there's delayed release. This is less about how long and way more about when and where. This type of pill releases its drug at a very specific time or in a specific place, like, say, only after it safely passed through the harsh acid of your stomach.
Okay, so this all sounds fantastic in theory, right? But how in the world do they actually pull it off? Let's take a look inside the pill and see the incredible science at work.
I mean, really, how do you tell a pill to wait or to release its content slowly over, say, 12 hours? It turns out there are a few incredibly clever ways to build what's basically a tiny time-release machine. So this gives us a quick look at some of the most common strategies. You can trap the drug in a kind of sponge, give the pill a smart coat that only dissolves under very specific conditions, or even build a microscopic pump that's powered by water. I mean, come on, how cool is that? Let's break down how these things actually work.
All right, check this out. With the sponge, the drug is tangled up in this complex web of polymers, and it has to slowly find its way out. The pH trigger is like a lock with a key. It has an acid-proof coating that only dissolves when it senses the change in pH in the intestine. And my personal favorite, the osmotic pump. This is just genius. It actually uses your body's own water, which gets drawn into the pill, builds up pressure, and then pushes the medicine out at a perfectly steady rate through a single, tiny, laser-drilled hole. Amazing.
Now, this technology is incredible, but like anything in medicine, it's all about balancing the benefits and the risks. So let's connect all this science back to the actual pills people use every single day. On the one hand, the advantages are huge. It's way easier to remember one pill than three, the effect is so much more stable, and you get to avoid those nasty side effect-inducing peaks. But there's always a but, right? There are trade-offs. You can't just cut these pills in half to change the dose, because you'd literally be breaking the machine. And there's a small but very serious risk of that machine failing, a problem called dose dumping. So what exactly is dose dumping?
Well, it's when that super carefully designed release mechanism breaks, and the entire dose, which could be enough for 12 or even 24 hours, gets released all at once. It's like a dam bursting. This can lead to dangerously high, even toxic levels of the drug in your system, and that is why the engineering of these pills has to be absolutely perfect.
Let's look at a real-world example you may have heard of. Concerta, a common ADHD medication, is a perfect case study of that osmotic pump we just talked about. The pill has this thin outer coat of the drug for an immediate effect in the morning, and then the internal pump takes over, delivering a perfectly steady dose for the rest of the school or workday before it finally wears off in the evening.
And here's another super clever design for a completely different problem: insomnia. Ambien CR uses a two-layer system. It's a 1-2 punch. The first layer dissolves really fast to help you fall asleep. Then, once you're out, the second, slower-releasing layer gets to work to help you stay asleep. It's a perfect example of tailoring the drug release to exactly what the patient needs.
So we've seen how this tech is already transforming medicine and making people's lives better right now. But believe it or not, this is really just the beginning. So let's nail down the big takeaway from all this, and then take a quick peek at where this technology might be heading next.
Ultimately, when you boil it all down, it comes back to this one core idea. The whole goal, the entire point, is to make medicine work better and smarter, to keep you in that perfect therapeutic sweet spot for longer, all while dodging those problematic peaks and valleys.
So, the next time you see ER or XL on a medicine bottle, you'll know what it really means. You'll know it's not just a pill. It's a tiny, sophisticated machine, precisely engineered from the inside out to make your treatment safer, more convenient, and a whole lot more effective. And that leaves us with one last, kind of mind-blowing thought. We've pretty much mastered controlling the timing of a drug's release. But what's next? What if we could design pills that release their medicine not just at a specific time, but at a highly specific location? Like, imagine a pill that could travel through your whole body and only release its payload directly at a tumor, leaving everything else completely untouched. Well, that's the next frontier, and it's called targeted release.